Have you ever wondered why some 70-year-olds look and feel like they're 50, while some 50-year-olds seem decades older? The answer, largely, lies beneath the surface. What's happening inside your body at the cellular and systemic level? Today, preventive medicine and longevity science give us powerful tools to peek under the hood and see what's really going on, long before symptoms show up. Welcome back to Longevity Blueprint. I'm Katie, and in this video, we'll explore the 5 most critical blood tests everyone over 40 should be doing regularly to monitor and enhance their long-term health. These aren't just your standard medical checkup labs. These are targeted biomarkers that can reveal deep insights into your health span potential and highlight areas needing attention. Knowledge is power, especially when it comes to your health. Let's dive into the data that could literally add years. Vibrant, functional years to your life. Before we get into the tests themselves, let's talk about why monitoring blood biomarkers is absolutely crucial if you're focused on living a longer, healthier life. 1. Early detection. Blood tests can detect issues years before symptoms appear. For instance, insulin resistance, a silent setup for type 2 diabetes, can begin over a decade before diagnosis. 2. Objective data. How you feel is important, but data doesn't lie. Biomarkers offer an unfiltered look at your internal reality. 3. Track trends over time. A single test is helpful, but repeated measurements reveal powerful trends in progress. 4. Targeted interventions. Instead of generic advice, you can fine-tune your health strategies based on what your body actually needs. 5. Motivation and feedback. Seeing numbers improve after lifestyle changes is incredibly empowering and oddly satisfying, we admit. Let's jump into the first test. Test number 1, Advanced Metabolic Panel. The Advanced Metabolic Panel is a cornerstone. It goes way beyond the basic fasting glucose your doctor may order. Key markers include fasting glucose. Optimal range for longevity is 70 to 85 milligrams per hour. HbA1c reflects average glucose over 2 to 3 months. Aim for 5.4%. Fasting insulin, a must. High insulin often precedes glucose issues. Ideal 5 mmol per milliliter. HOMA-IR, calculated insulin resistance score. 1.0 is excellent. C-peptide, indicates insulin production, helping differentiate metabolic issues. Why it matters. Poor glucose regulation is linked to nearly every age-related disease, from heart disease to dementia to cancer. Interventions. Cut refined carbs, try intermittent fasting, high-intensity training, and consider berberine or ALA supplements. Test number 2, the Advanced Lipid Panel. This digs deeper than total cholesterol or LDL. Essential components: LDL particle count, LDLP, far more predictive than LDLC. LDL particle size, small, dense particles with higher risk. Apolipoprotein B, ApoB, top predictor of atherosclerotic risk. Lipoprotein A, a genetic risk marker, important yet often ignored. HDL particle size and count, quality matters more than just quantity. Triglycerides, high levels are linked to insulin resistance. Cardiovascular disease is still the #1 killer. This panel gives you a precision map of your risk. Fixes depends on your profile, but can include diet tweaks, omega-3s, exercise, and yes, in some cases medications, but personalized ones. Test number 3, inflammation markers. Chronic, low-grade inflammation, Inflammaging, is a major aging accelerator. Key markers: HSCRP, goal is less than 1 milligram, 1.5 is better. Homocysteine, high levels linked to heart and brain issues. Aim for less than 7 mmol per liter. Uric acid, ideal range is 3 to 5.5 milligram per liter. Ferritin also reflects inflammation. Stay within ideal gender-specific ranges. Fibrinogen, elevated levels, higher cardiovascular risk. How to bring inflammation down. Anti-inflammatory diets, omega-3s, curcumin, quality sleep, less stress, and maybe fewer YouTube comment wars. Test number 4, hormones. Hormones are like your body's Wi-Fi. When they're off, nothing runs smoothly. Key hormones to monitor. Thyroid panel, full panel, TSH, free T3, T4, reverse T3 antibodies. Vitamin D, technically a hormone, ideal levels 40 to 60 nanograms per milliliter. Cortisol, best measured throughout the day. IGF-1, linked to aging and longevity. For men, total and free testosterone, SHBG, estradiol. For women, estradiol, progesterone, SHBG, testosterone. Declining hormones affect energy, cognition, libido, muscle mass, you name it. Options: sleep, resistance training, stress reduction, targeted supplements, and in some cases, bioidentical hormone therapy. Test number 5, nutritional markers. Finally, let's talk nutrients. Subclinical deficiencies can quietly sabotage your health. Key markers: B12 and folate, critical for brain, DNA, and methylation. Iron panel, too much or too little trouble. Magnesium RBC, better than serum magnesium, crucial for 300+ processes. Zinc and copper, balance is key. Omega-3 index, low omega-3, you're aging faster. Vitamins A, E, and K2, underrated heroes of longevity. Boost levels through diet first, but personalize with supplements when needed. Okay, you're convinced. Now, how do you get these tests? 1. Work with a functional or longevity-focused doctor. 2. Use direct-to-consumer labs like Inside Tracker or Life Extension. 3. Ask your traditional doctor. You may need to explain why. 4. Hybrid approach. Mix medical with DTC tests. Most people can retest yearly, more often if you're correcting a known issue. Tracking these 5 blood test panels can help you spot silent issues early, optimize interventions, and, let's be honest, age like a boss. Forget normal lab ranges. Aim for optimal. Because average health outcomes? Not exactly inspiring. Have you discovered a surprise biomarker before? Share your blood test wins in the comments below. If you found this video helpful, give it a like and subscribe for more evidence-based strategies on aging, wellness, and health span. In our next video, we'll explore how to activate autophagy, your body's natural cleanup crew for cellular longevity. Thank you for watching, and remember, when it comes to health, data is not just knowledge, it's power.